Hi, my name is Noel Batten and this is my natural health education video number 2, checking for a C1 misalignment. Back in 2002 I discovered that every single Parkinson and MS patient I assessed had a C1 misalignment, or what chiropractors call an atlas misalignment, so I started to investigate the possibility that this was actually the primary cause of all Parkinson and MS symptoms. Whilst I was correct in this assumption, I found that there were so many secondary causal factors that caused the C1 vertebra to come out in the first place, that unless a health practitioner overcame all these secondary causes, the C1 would just keep coming back out of alignment, sometimes within minutes of a chiropractor adjusting it, which meant that the symptoms would never go away, or they would come back soon after they did. Within my BA10 personal treatment program, which I designed to monitor the alignment of the C1 vertebra while I worked to overcome all these other secondary causes, I teach my clients 3 different exercises that they can use to monitor the alignment of their C1 themselves. This becomes their most important self-healing task from that moment on. This education video shows me explaining to one of my clients how to check the alignment of the C1 vertebra. What I want you to do is get used to knowing how to feel your own cervical spine to know whether it's time to go to the chiropractor. Firstly, you do the 3 neck turn tests. You can turn your chin, bring your shoulder up and touch your shoulder and be aware of what your neck feels like. If you feel a twinge somewhere, you would suspect it's time to see the chiropractor. The same thing with the other side. Be aware of what your neck's doing when you turn like that. Listen to your left shoulder, listen to your right shoulder, be aware of the C1 area and down your neck, and then look right up to the ceiling. If you've got a C1 misalignment, usually you'll feel it when you do that, or when you do this one. And then chin to your shoulder, to your chest, and be aware of what feelings you're having in your neck. If you feel specific twinges in one area, you can pretty well be sure that you've got a misaligned vertebra. But this is then how you check. Put your hands on the back of your head and put your thumbs, just come around here. Put your thumbs in the 2 hollows just at the base of your skull around from your ears. Now, if you feel the one is a bit puffy more than the other, then there's a chance you'll have a misaligned C1, because that is the area of the C1, just below the base of the skull in those 2 little hollows. Now, if you feel inflammation and you press against the inflammation and it's tender, then you're pretty sure you'll have a misaligned C1, and that's the most important vertebra in your spine. If that's out, that can cause your L4, L5 down at the base of your spine to go out, or anything along the way, because it pinches muscles that support the spine, and then those muscles being tight on one side can pull anything out. So it's really important to monitor that C1. So then from there, keep your fingers on your head, but work your fingers like that down your spine. And when you press at the side of each vertebra, if you feel one that's tender and swollen, okay, mine's good this morning. I go right down to the top of the shoulders, and mine's good this morning. I don't have any misalignments. But if you feel some area that's a little swollen or a little bit puffy, that's got inflammation there, and when you press hard on it, it's sort of a little touchy, you'll have a misalignment. Okay. And the neck is the most important area of your body as far as your spinal nervous system and the nerves that go to your organs and limbs are concerned. You can actually have a misalignment at your C1 vertebra at the very top of your spine, and depending on the way it's misaligned, it can cause your toes to go into a spasm. Just your toes. That's how the C1 is. There's thousands of nerves that, you know, can be affected by a C1 misalignment.
Are you saying that is why a lot of times that you will get spasms?
Yes.
Like you lay down in bed and then you move a little bit wrong and you'll get a spasm
Yes.
in your calf or in your foot?
Yep.
Is because you got a misalignment in your back?
Well, yes, that most definitely. However, a muscle spasm can sometimes be caused through lack of salt. People who avoid salt and use their muscles, they're physically active, can actually experience a cramp, a muscle cramp. Nightmares are often caused by lack of sugar, and muscle cramps are, as a general rule, caused by lack of salt.
Mm-hmm.
But it can also be lack of blood circulation to get the sugar or salt throughout your body. But yeah, most commonly a misalignment or a nerve that's a vertebra that's worn. When you turn your head a certain way, it can cause a cramp or a spasm in a foot. It's very interesting. You'd be surprised how many elderly people have got memory problems because they've got a misaligned C1, C2 vertebra.
Well, then would you put mine back in so that I can remember?
Whilst it is reasonably easy for most chiropractors to realign a C1 vertebra, it is often not so easy to find all these secondary causal factors that keep pulling it back out of alignment. On many occasions, I've found that sitting at a computer watching the monitor while it is a little off to the left or right, hence keeping the head turned to one side all day long, or looking down a lot for many hours in a day, texting and reading iPads and so forth, can encourage the C1 vertebra to come out of alignment. I've also discovered that suppression of grief or anger or fear can cause the neck muscle on one side to go really tight and pull the C1 vertebra in that direction. In fact, I've also found that the subject of grief or anger or unforgiveness or fear can have an influence on which neck muscle becomes really tight to pull the vertebra in a specific direction. Possibly the most common emotional problem that I've found in the clients I've treated is suppression of grief. And I found that suppressing grief over a male will cause the neck muscles on the right side of the neck to become excessively tense, and suppression of grief over a female will cause the muscles on the left side of the neck to become excessively tense and pull the C1 vertebra in that direction. Once the C1 vertebra is out of alignment, it can pinch any number of nerves to cause Parkinson and MS type symptoms anywhere from the top of the head to the feet. This includes optic neuritis, loss of hearing, loss of sense of smell, difficulty swallowing, and loss of the sensation of taste. If you have found that a chiropractic adjustment has helped you but not for long, don't give up on chiropractic. Just understand that there will be quite a few other secondary causal problems in your system that are provoking the C1 to come back out of alignment soon after your chiropractor corrects it.